Neurodevelopmental disorders. Neurodevelopmental disorders refer to a group of conditions that arise from disruptions in the development of the nervous system, particularly the brain. These disorders typically manifest early in a person's life, often during infancy or childhood, and they can have a lasting effect on various aspects of functioning, including cognition, behavior, social interactions, and motor skills. The underlying causes of neurodevelopmental disorders are diverse, involving a combination of genetic, environmental, and neurological factors. Here are some types of neurodevelopmental disorders, starting with intellectual disability. Intellectual disability, also known as intellectual developmental disorder, is a complex neurodevelopmental disorder that affects a person's cognitive capacities and their interactions with the environment. It is characterized by limitations in intellectual functioning and adaptive skills, which are shaped by the person's environmental supports. The diagnosis is based on clinical assessment and standardized testing, and the criteria include significant limitations in intellectual functioning and adaptive functioning, as well as onset during childhood or adolescence. It is important to note that intellectual disability is not something a person has or is, nor is it a medical or mental disorder. Rather, it is a condition that requires ongoing support for the person to function adequately in various life settings. The causes of intellectual disability can be categorized into biological and social factors, starting with biological factors. These include prenatal illnesses and conditions such as maternal infections or exposure to harmful substances during pregnancy. Genetic abnormalities such as Down syndrome or Fragile X syndrome can also cause intellectual disability. Other factors include premature birth, birth injuries, and certain childhood illnesses or traumas. Second are social causes. Social causes include lower socioeconomic status, which can lead to inadequate prenatal and medical care, malnutrition, and exposure to environmental hazards. Parental neglect or abuse, institutionalization, and deprivation of social and linguistic stimulation can also contribute to intellectual disability. Delayed diagnosis and lack of early intervention can also be contributing factors. It is important to note that about 60% of cases, the specific cause of intellectual disability is unknown. Moving on, here are the signs and symptoms of intellectual disability. The signs and symptoms of intellectual disability can vary depending on the severity of the condition. However, some common signs and symptoms may include: first, intellectual functioning. Individuals with intellectual disability may have below average intellectual functioning, which can affect their ability to learn, reason, and problem solve. Next, adaptive functioning. Difficulties in adaptive functioning, which include skills needed for daily life, such as communication, self-care, social interactions, and independent living, may be present. Developmental delays. Delays in reaching developmental milestones, such as sitting up, crawling, walking, or talking, may be observed in individuals with intellectual disability. Learning difficulties. Individuals with intellectual disability may have difficulties in acquiring and retaining new informations, which can impact their academic performance. Next, poor problem solving and reasoning skills. Difficulties in logical thinking, problem solving, and abstract reasoning may be present. Social and communication challenges. Individuals with intellectual disability may have difficulties in social interactions, understanding social cues, and communicating effectively. Lastly, memory problems. Some individuals with intellectual disability may have difficulties with memory, both short-term and long-term. It is important to note that the signs and symptoms can vary greatly among individuals with intellectual disability, and early intervention and support can greatly improve their quality of life. It is recommended to consult with a healthcare professional for a proper diagnosis and individualized treatment plan. So here's what a social worker can do as an intervention. First on the list is to provide counseling and support to individuals with intellectual disabilities and their families to help them cope with the challenges they face. Next, assist individuals in accessing and navigating available services and resources, such as healthcare, education, employment, housing, and transportation. Next, conduct assessments of adaptive functioning to determine the individual's strengths and areas of need, and develop individualized plans to improve their functional abilities. Implement psychosocial interventions such as applied behavior analysis, cognitive behavioral interventions, environmental management, and client and family educations to help individuals improve their skills and behaviors. Advocate for individuals with intellectual disabilities to ensure they receive appropriate support and services and to address any barriers or inequities they may face. Next, collaborate with other professionals such as educators, healthcare providers, and community organizations to coordinate and enhance the support and services provided to individuals with intellectual disabilities. Provide education and training to families and caregivers on how to best support and care for individuals with intellectual disabilities. And lastly, engage with policy advocacy and community outreach to raise awareness about the needs and rights of individuals with intellectual disabilities and to promote inclusion and equal opportunities for them within the society.
Autism spectrum disorder or ASD is a neurodevelopmental disorder that affects social interaction, communication, and behavior. It is characterized by difficulties in social interaction and communication, repetitive behaviors, and restricted interests. ASD is a spectrum disorder, which means that it can range from mild to severe and can affect individuals in different ways. It typically appears in early childhood and lasts throughout a person's lifetime. ASD is diagnosed based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders. Causes. The causes of autism spectrum disorder are not fully understood. It is believed to be a genetic and neurobiological disorder, meaning that it is influenced by both genetic factors and abnormalities in brain development. Some environmental toxins may also contribute to its development, although there are no known psychological or social factors that cause ASD. Risk factors for ASD include genetic loading, brain abnormalities, elevated levels of serotonin, male gender, premature birth, and older age of parents. Protective factors include being a later born child, younger age of parents, and a full-term pregnancy. Signs and symptoms. The signs and symptoms of autism spectrum disorder can vary wildly, but they generally fall in two major diagnostic domains. First is the deficit in social communication and interaction, such as absence of back and forth communication, unwillingness to share or engage in social interactions, difficulties with nonverbal communication, such as eye contact and body language, lack of facial expressiveness, challenges in developing and maintaining relationships, including difficulties adjusting behavior and a lack of interest in peers. Second, restricted repetitive patterns of behavior, such as stereotypical, repetitive motor movements, insistence on sameness and resistance to change, highly restricted and fixated interest, hyperactivity or unusual interest in sensory aspects of the environment. It's important to note that these symptoms can vary in severity and may be accompanied by other features, such as intellectual impairment, language impairment, or the presence of other neurodevelopmental, mental, or behavioral disorders. The level of severity is determined based on the assessed symptoms in the two core areas. Interventions. As a social worker, there are several interventions you can provide for individuals with autism spectrum disorder. Some of these interventions include spatial education. You can help facilitate the provision of an appropriate educational plan for children with ASD. This may involve advocating for necessary ancillary services such as speech or language therapy, occupational therapy, and physical therapy. Behavioral management. You can assist in behavioral management by examining the antecedents and consequences of problem behaviors and implementing strategies to address them. This may involve removing avoidable antecedents, teaching new behavior, and providing positive reinforcement for appropriate behaviors. Social skills training. You can provide social skills training to individuals with ASD to help them improve their social interaction and communication skills. This may involve teaching them how to recognize social cues, engage in conversation, and develop appropriate social behaviors. Vocational habilitation. You can support individuals with ASD in developing vocational skills and finding employment opportunities. This may involve providing job coaching, assisting with resume building and interview skills, and connecting them with vocational training programs. Family or caregiver support. You can provide support and resources to families and caregivers of individuals with ASD. This may involve helping them understand the disorder, cope with the challenges they face, and access community resources and support networks. It's important to note that the specific interventions provided by a social worker may vary depending on the individual's needs and the resources available in their community.
Attention Deficit Hyperactivity Disorder (ADHD) is a neurodevelopmental disorder that is characterized by persistent patterns of inattention, hyperactivity, and impulsivity that interfere with daily functioning and development. It typically begins in a childhood and can continue into adolescence and adulthood. ADHD can affect various aspects of a person's life, including academic performance, social relationships, and overall well-being. It is diagnosed based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders DSM-5 treatment for ADHD. Often includes a combination of medications, behavioral therapy, and support from parents, teachers, and other professionals. Causes. The exact cause of attention deficit hyperactivity disorder (ADHD) is not known. However, research suggests that a combination of genetic, environmental, and neurological factors may contribute to the development of ADHD. Some potential causes and risk factors include genetics. ADHD tends to run in families, suggesting of genetic component. Certain genes related to brain function and neurotransmitter regulation may play a role in the development of ADHD. Second, neurological differences. Studies have shown that individuals with ADHD may have differences in the structure and functioning of certain brain areas involved in attention, impulse control, and executive functions. The third is environmental factors, prenatal exposure to tobacco smoke, alcohol or drugs, as well as premature birth, low birth weight, and exposure to environmental toxins may increase the risk of developing ADHD. The last one is brain injury. Damage to the brain, such as from traumatic brain injury or infection, may increase the risk of developing ADHD. It's important to note that ADHD is a complex disorder, and the specific causes can vary from person to person. More research is needed to fully understand the underlying causes of ADHD. Signs and symptoms. The signs and symptoms of attention deficit hyperactivity disorder or ADHD can vary depending on the individual can be categorized into three main types: inattention, hyperactivity, and impulsivity. Inattention symptoms may include difficulty paying attention to details and making careless mistakes, trouble staying focused on tasks or activities, difficulty organizing tasks on activities, easily distracted by external stimuli, forgetfulness, and frequently losing things, avoidance or dislikes of tasks that require sustained mental effort. Hyperactivity symptoms may include constant fidgeting or screaming, difficulty staying seated or remaining still, excessive talking or interrupting others, difficulty engaging in quiet activities, restlessness, and always being on the go. Impulsivity symptoms may include acting without thinking about the consequences, difficulty waiting for their turn, frequently interrupting or intruding on others, impatience in difficulty delaying gratification. It's important to note that not everyone with ADHD will exhibit all of these symptoms, and the severity of symptoms can vary. Additionally, these symptoms must be present in multiple settings, for example, home, school, work, and interfere with daily functioning in order to meet the diagnostic criteria for ADHD. Interventions. A social worker can play a crucial role in the intervention for children with ADHD. Here are some possible interventions that a social worker can implement. Number one is provide psychoeducation. The social worker can educate parents and caregivers about ADHD, its symptoms, and its impact on the child's functioning. This can help them better and understand the challenges the child faces and develop appropriate strategies to support them. Number two is parent training. The social worker can provide parent training sessions to each parent's effective parenting strategies and behavior management techniques. This can include teaching parents how to set clear expectations, establish routines, use positive reinforcement, and manage challenging behaviors. Third is collaborate with schools. The social worker can work closely with teachers and school staff to develop individualized education plans or 504 plans for children with ADHD. They can advocate for appropriate accommodations and modifications in the classroom to support the child's learning and behavior. Fourth is support groups. The social worker can facilitate support groups for parents of children with ADHD. These groups can provide a safe space for parents to share their experiences, learn from each other, and receive emotional support. The fifth is referrals and coordination. The social worker can help connect families to other resources and services in the community, such as mental health professionals, occupational therapies, or speech therapies. They can also coordinate care between different professionals involved in the child's treatment. It's important to note that the specific interventions may vary depending on the needs of the child and the resources available in the community. A social worker should always assess the individual situation and tailor interventions accordingly.
Oppositional defiant disorder and a conduct disorder. Oppositional defiant disorder, or ODD, is a psychiatric disorder characterized by a pattern of negative, hostile, and a behavior towards a authority figures such as teachers and parents. So, children with ODD often lose their temper, argue with adults, refuse to comply with rules or requests, deliberately annoy others, blame others for their mistakes, and display anger and resentment. So, this behavior persists for at least 6 months and occur more frequently than is typically observed in a children of a comparable age. So, ODD is usually evident before age 8 and not later than an early adolescence. So, in conduct disorder or CD is also a psychiatric disorder characterized by a entrenched pattern of behavior in which the basic rights of others or major age appropriate societal norms or rules and violated. So, This pattern involves aggressive and conduct causing harm to people or animals, non-aggressive conduct leading to property loss or damage, deceitfulness or theft, and serious violations of rules. So at least three of these behaviors need to have been present in the past year, with at least one behavior demonstrated in the past 6 months. So CD can be a developmental antecedent to a antisocial personality disorder in adulthood. It is more important to note that ODD and CD are separated diagnoses, but they are often discussed together because they are overlap considerably in terms of symptoms and behaviors. ODD is often a developmental antecedent to CD, and many children with CD have had an early ODD diagnosis. The causes of oppositional defiant disorder and a conduct disorder can be categorized into different factors such as biological, psychological, and social. So the first one is the biological factors, the early onset. So ODD and CD are more likely to develop if symptoms are presented at a young age. So in low autonomic nervous system activity, individuals with lower activity may have difficulty regulating their emotions and behaviors. In gender, ODD is more common in males, while CD is more common in females. And in verbal intelligence, low verbal intelligence is associated with an increased risk of ODD, while high IQ is associated with a decreased risk. So, in psychological factors, ADHD, having a comorbid ADHD increases the risk of developing ODD and CD. So, lack of guilt or remorse. Individuals who lack of guilt or remorse for their actions are more likely to exhibit ODD and CD behaviors. So, in lack of empathy, difficulty showing empathy towards others is likely associated with an increased risk. In low harm avoidance, individuals who have a low ability to avoid harm are more likely to engage in ODD and CD behaviors. And lastly is the lack of emotion expressions. So, difficulty expressing emotions may contribute to the developmental of ODD and CD. And the last one is the social factors. So family, being born to a teenage mother, having an antisocial biological parent, and living in a low socioeconomic status are risk factors of ODD and CD. On the other hand, being born to an adult mother and having a prosocial biological parents can be protective factors. And last is the community, um, living in a low socioeconomic status and being exposed to delinquent peers increase the risk of ODD and CD. Conversely, living in a middle to upper socioeconomic status and having a pro-social peers can be protective factor. So it is important to note that these factors interact with each other and can vary depending on the individuals and other environments. So these are the signs and symptoms. In the ODD or oppositional defiant disorders, the first one is the frequent temper tantrums or angry outbursts, arguing with adults, often refuses to comply with rules or requests, deliberately annoying others or provoking others, and blaming others for their mistakes or misbehavior, easily annoyed or angered by others, and being spiteful or vindictive. And from the conduct disorder or the CD, signs and symptoms include the aggressive behavior that causes harm to people or animals, destruction of property, deceitfulness or theft, and the serious violations of rules and law. So it is important to note that this behavior must persist for a significant period of time or for at least 6 months and occur more frequently than what is typically observed in a children of a similar age and developmental level. So additionally, CD may involve in a pattern of behavior that consistently violates the rights of others and the societal norms.
Intervention. A social worker can implement various interventions to address oppositional defiant disorder (ODD) and conduct disorder (CD). Some possible interventions include: number 1, parent training. Social workers can provide parents with training on effective parenting techniques such as setting clear expectations, using positive reinforcement, and implementing appropriate discipline strategies. 2. Multisystemic therapy (MST). Social workers can utilize the MST approach, which focuses on multiple systems in a child's life, including the family, school, peers, and community. This approach aims to address the underlying factors contributing to the child's behavior and promote positive change. 3. Functional Family Therapy (FFT). Social workers can use FFT, which focuses on improving family interactions and communication patterns. This approach helps families identify and address the functions that problem behaviors serve within the family system. 4. Individual therapy. Social workers can provide individual therapy to children and adolescents with ODD and CD. This therapy may involve cognitive behavioral techniques, anger management, social skills training, and problem-solving skills development. 5. Treatment foster care. Social workers can refer children and youth with severe and chronic delinquent behavior to treatment foster care programs. These programs provide intensive support and treatment within a foster home setting, with the goal of reintegrating the child back into their home and community. 6. School-based interventions. Social workers can collaborate with schools to implement social skills training programs and interventions that focuses on improving relationships with peers and building social skills. It is important for social workers to assess the specific needs and circumstances of each individual and tailor interventions accordingly. Additionally, ongoing monitoring and evaluation of the interventions are crucial to ensure their effectiveness.
Let us dismantle the barrier of stigma surrounding neurodevelopmental disorders, recognizing that within every unique mind lies a universe of potential. Embrace understanding, foster empathy, and champion inclusivity. For it is in our collective acceptance that we unlock the extraordinary capabilities painted into the canvas of neurodiversity.